The U.S. trade embargo on Cuba has had a major impact on social and economic services in the country. Cuban officials say the 60-year embargo has taken a serious toll on healthcare and access to medication. CGTN's Luis Chirino reports from Havana.
82-year-old Angela Estrada suffers from high blood pressure and acute asthma. She welcomed CGTN to her home and told me about how difficult it is to get her medicine.
Los tres medicamentos han estado siempre muy en falta.
The medicine I take hasn't been available at the drugstore since last year. Recently, they provided me some medicine, but it isn't enough to meet the demand of those who need the medicine.
Angela told me that, like many other senior citizens, she has made huge efforts to get her medication.
Nos teníamos que levantar nosotros los ancianos.
We senior citizens have had to wake up as early as 3 or 4 in the morning to queue at the drugstore because of the lack of medicine.
In a statement to CGTN, Dr. Eduardo Martinez, the president of Cuba's pharmaceutical industries, CUBA Pharma, explained what's behind the medicine shortage.
The main cause leading to medicine shortage and also affecting the biotech sector is the U.S. blockade. Cuba has faced this blockade for over 60 years, which has been stiffened and affects sensitive areas.
Martinez told me that the U.S. embargo on Cuba blocks his company from collecting export revenue necessary to get raw material to produce medicine. Dr. Martinez said that Cuba produces 63 of all controlled drugs for specific conditions, but the availability of 20 drugs has been impacted by unstable production. David Arjona is another Cuban in Havana who has been the victim of the medicine shortage on the island.
Accessing medications has become a torture for Cubans. I suffer from diabetes and high blood pressure, and for the past 3 months, I haven't been able to get my medications.
However, Cubans do not remain armed crossed before the big challenge, says Dr. Martinez.
We are hard at work to replace imports of raw material with local production. We are implementing financial strategies and looking for new providers of raw materials for our industry.
The U.S. trade embargo has been condemned by the Cuban government and by the international community for its negative impact on the economy, including the healthcare sector. Luis Chirino, CGTN, Havana.